Americans could get new guidance when it comes to wearing masks outdoors.
Yeah, we're told that NBC News has learned that President Joe Biden expects to announce new CDC guidance on that subject as early as today. This morning, Dr. Dana Hawkinson from the University of Kansas Health System joins us live to talk more about this. Doctor, good morning. We know there will likely be guidance for those who are fully vaccinated versus those who are not, rules for if you have your shot and if you don't. Do you expect this to be more like for doing things like wearing a mask at a park or wearing a mask at a Royals game in Kauffman Stadium? Do you have any idea what to expect on what those might be difference-wise versus if I have my shot and if I don't?
Yeah, I don't really know exactly, but just like you said, it will be outdoors. It is not indoors, but it will probably be for some of those larger public things, like if you go to a game or a stadium or just being outdoors and eating. And certainly I think it's going to revolve around being vaccinated or unvaccinated as well, because we know vaccination offers benefits to you individually, but also to your community.
And Doctor, we know the Johnson & Johnson vaccine was paused for a few weeks due to a rare blood clot side effect. Last week, the CDC and FDA said it was safe to start using the one-dose vaccine again. Kansas is expected to get a shipment of 1,700 doses next week. What's your message for those who may feel even more hesitant now to take the Johnson & Johnson vaccine?
Yeah, just as an allusion to our first question, what about vaccines? What can it do for me? Individually, it's going to protect you. We know that it's going to protect you from severe disease, from going to the hospital, from death. It will protect you from the whole spectrum of disease. What is one thing that it will protect you from? Blood clots as well, from getting the disease itself. We know COVID-19 carries a risk of about 20% of people getting those blood clots. We know blood clots have been associated with the Johnson & Johnson vaccine, but it is an extremely rare event with the vaccine itself as compared to just getting the disease. So we know that can happen. We know how to watch out for it. We know how to diagnose it and treat it as well. The vaccines are safe, and again, they will protect you individually from the whole spectrum of disease, including blood clots, which a high percentage of people with COVID-19 do actually get. But it will also hopefully be able to protect our community, because there are signals and there is data to support that you actually have a less chance of transmitting the disease after vaccination as well.
Doctor, we're getting more data about the shots right now. Every day it's coming in. The CDC says about 92% of people got their second dose of the Pfizer or Moderna vaccine within that recommended timeline. But that still leaves a group of people, roughly 5 million, who did not get their second shot. Do you have an idea of why this is? Is it because people feel getting that second dose won't make a drastic impact? I heard Senator Roger Marshall of Kansas last week on a national broadcast. He answered a question about why he's being told people aren't getting the vaccine is because it's not going to change that person's life significantly. We're still going to have to wear a mask. We're still going to have to social distance. Do you have an inkling as to why people are not getting at least that second shot right now after they've taken the trouble to get the first?
Yeah, I mean, a small percentage of that group you talked about, it just could be data delays. Maybe those people got the second dose of vaccine at another spot than where they got the first. But that is one of the points that we talked about initially when we first heard stories about, especially Europe, wanting to delay the second dose so they could get as many people vaccinated as possible, or in the UK. And I think that's okay to delay that second dose by 2, 3, 4 weeks. But we really know the best protection from disease is getting that 2-dose regimen of Moderna and Pfizer. That offers the optimal protection for you, the longer lasting protection as well. It could just be complacency. People think, well, I got my first dose, I know I get antibodies, or I've seen stories about antibodies in the news, and I know I make antibodies, so I'm protected. But that really isn't the way to go about it. The way that we can continue to do these things and reevaluate mask guidance, reevaluate lifting restrictions in our community, getting back to normal, is by following the science and doing what these trials have shown. And they have shown, especially for Moderna and Pfizer, that getting that 2-dose vaccine really offers you the best protection individually, again, to protect against the side effects of the blood clots, which, again, up to 20% of people could get, but also protect against the spectrum of disease, especially hospitalization, severe disease, and death. And then, again, protect your community by probably reducing the risk of transmitting that disease if you should get it once you're vaccinated. So I think all of those things are in play. I suspect most of the time it's just complacency and just figuring, hey, I got the first dose. I don't necessarily need to get the second dose.
Sure.
Well, Dr. Hawkinson, thank you so much for joining us this morning. We really appreciate it.